There are a lot of facts and myths about mental health. And before now, it's been said over time that a lot of people that have mental illness, probably they should be on the streets. But this is one of the myths that we are going to be talking about today. And of course, you can't be talking about mental health without health. And of course, health itself is all-encompassing. Of course, it encompasses what we are talking about today, which is mental health. By World Health Organization standard, the health is defined as a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. So the infirmity aspect of it and also the mental aspect of it is very important at this time. And of course, what exactly are we talking about when you say mental health? Mental health is a state of well-being that enables you and I to cope with stress of life. If you are able to cope with the stress of life, then you are having a stable mental health. And of course, when you realize your potential and you are able to learn well and cope with your work, your job, your occupation, anything you lay your hands on, you are able to cope with it on a daily basis. And of course, the last point here is that you are able to contribute to your society, you are able to contribute to your community. You need to get all of this in place before you can have a stable mental health. And of course, in this meeting tonight, the objective of this meeting is for us to know what is mental health, which I just talked about now, and to identify the common mental health, and of course, what are the symptoms, the salient symptoms you can see if someone has a mental health. So, mental illness rather. So now, the concept of mental illness or mental health is an integral part of health, as I've just defined now. There is no way you can define health without the component of mental health. Of course, you can say that you don't have hypertension, don't have diabetes. That does not mean that you are fully stable in terms of health. It's an integral part of health, and you need to take care of it very well. So, of course, it's our basic human right of life to have a very stable mental health. So, mental health, it exists in a complex continuum. We experience a mental health in different phases of life. Of course, there are different issues of life that could actually make one to have mental health. What are the types of mental health that is quite common around us? We have the depression, which is very common, both in men and women. And of course, women tend to present more with depression. I will talk about the commonest one in this meeting. And of course, we have anxiety, we have schizophrenia, we have bipolar affective disorders, we have other personality disorders, we have diverse of them. And of course, I won't forget the issue of substance use disorder. They are all part of mental illness. So now in this gathering, because depression is quite common, and in fact, more common than you can ever see. In fact, in 1 out of 4, it is said that they are depressed. But depression now depends on the severity, the degree to which you are depressed. So that is the standard. That is World Health Organization standard. In depression is common mental disorder, and globally, it is estimated that 5%, that means 5 out of 100 of people, adults, suffers from one form of depression or the other. Of course, like I said before, it's commoner in female than male, women than men, and of course, it could also lead to suicide. You must have heard that someone just went straight to commit suicide based on 1 or 2 issues. So what are you to look out for when you are depressed? Number 1 is you feel very down. Everything looks so dark, and your energy begins to go down. Appetite is gone. Your sleep is not in order. You find it difficult to initiate sleep. You find it difficult to maintain sleep. And of course, you find it difficult to wake up on time. And after a long hours of sleep, you feel quite unrefreshed to go back to your work on a daily basis. So if you have been having this, is either your appetite is down or at the other end is quite huge. But all of these, it will culminate in you not having the desired capacity to take care of yourself, to cope with the work and stress of life on a daily basis. So, and of course, let me briefly talk about the anxiety. Anxiety, I would say anxiety is just a normal response to a stressful stimulus. But when it begins to affect what you do, when it begins to affect your job, your occupation, you fear when no other person is afraid. This fear envelopes you to the point that you begin to have a company of persons around you. Then is a disorder at that point. So what are the things you experience when you have anxiety disorder? Then you experience extreme form of fear, fearful events that you're unable to pinpoint whatever is it, the situation. You are nervous, and also you're restless, you are tense in all things, and of course you're unable to stand still, or sometimes your hand shakes without anything happening around you. You are afraid to take any steps, and there are different forms of anxiety. You have someone could actually have post-traumatic stress disorder. This is quite common around people that have major loss events around them. You begin to have re-experiencing of what has happened to you. For instance, probably you have an experience of almost kidnapping experience, and of course, by the time you are going along that path, such memory comes back and you begin to have a re-experiencing. That's post-traumatic stress disorder. But at the initial stage, it could be acute stress reaction, but depends on how you are able to get to see your therapists. You can be out of all of these. And of course, you can be panting. And of course, when you are panting so high, you begin to think probably this could be a heart-related problem. And you get to your cardiologist, they are talking about there is no other thing apart from your pulse being high. So that means you need to look quite inward to see what exactly is happening around you at that time. Of course, you could also be sweating excessively when no other person is sweating around you. Please note that this is a sign of anxiety disorder. Of course, you'll be trembling, and of course, you could feel very weak, and of course, your heart will be pounding so much that you are aware. Ordinarily, every person here, you are unaware of that your heart is beating. But when you are quite aware of your heart beats very fast, then you begin to realize, aside from every other thing that could be happening, probably be it your heart condition, if that is ruled out, then be rest assured that you are having anxiety. So what are the causes of mental illness generally? Well, mental illness does not just come in one area of life. It's all-encompassing. It could be that you have someone somewhere around your family that has such history before, then it's likelihood of you having it. But this is not directly so, because you could actually have someone around your family, be it your brother, your father, your mother, that has similar illness. It doesn't mean that you must have mental illness, but there needs to be an enabling environment that will activate such development of mental illness. So without, whether you have family history of mental illness, you need an instance, you need a precipitating event to actually open it up for you to develop the disorder. So of course, when you have all of these, there are different ways one could actually come down with mental illness. There are family issues, there are psychological issues, and there are social issues. What are the psychological issues? One of the presenters just mentioned something about fuel and also economic instability. When there is a sudden rise in your bills and you're unable to cope with it, and you're unable to see that tomorrow is quite better, is quite fine, then it begins to have extreme form of worries. So there are a lot of things that could actually make someone to be depressed or even have anxiety, especially in this time. So you need to manage your mental health very well, and of course, without it, you can't have a stable mental health. I will just have to say one or two things before I leave this stage now. Of course, among men and women, we have mental illness could occur in anyone, whether adults, whether children, In fact, it could be as early as 2-year-old having some childhood disorders, mental disorders, till the adulthood, till the very elderly. So it cut across all ages, and it cut across whether you are a man or woman, whether you are white or black. So it doesn't have any predilections to any person. Okay, and of course, 3/4 of adults who go missing, and of course, suicide, on the other hand, is said to be commoner among women. I mean, the attempt. But the complete suicide, it tends to be commoner among men. Of course, if I'm saying now that attempt is a form of, you are going to take maybe tabs, you want to kill yourself and all of that. That is quite common among women. But seeing someone jumping from a bridge and all of that, using heavy objects, is commoner in male. So now, how do I protect my mental health? So you need to talk about your feelings. And of course, you need to be open. Until you are open up to someone around you, you can't know, people might not know what you are passing through. Just listen, just speak out, and you'll be listened to, and every other thing can be taken care of. Don't keep silence, speak up, and you receive the desired help. Of course, like I said before, sleep is a central issue in mental illness. So the moment you begin to lose your sleep, seek for help, and take a good night's sleep. Let your sleep be deliberate. Let your sleep be conscious. Be conscious of your sleep pattern. Ensure that you have a regular sleep pattern, and don't negotiate your sleep for any other thing. Sleep well at night. Of course, what is the normal hours of sleep? 6 to 8 hours is actually adequate. Ensure that you are getting this every day. Of course, you need to eat well. Eat a very good meal. I mean, and don't eat late in the night. Some will actually, they do eat very late in the night. Apart from you not sleeping well, there are a lot of things that could actually go wrong with eating late in the night, because you are giving yourself a lot of activities, all your organs that need to work, you are giving them a lot of works during the night, and that could actually lead to other medical conditions. Eat early, eat healthy, and of course, stay active. Physical activity does not only give you fitness, but it also help your mental health. And again, practice what you know how to do best for yourself. Have a very good, positive way of thinking. Think more on positive things than the negative things every day, and keep your hope alive. And of course, keep in touch with positive friends around you, people that can actually stimulate your activities, your well-being. Keep around them, hang around them, and you feel good on every day. And of course, you need to care for others, whether that's working on a relationship with family and letting go of old grudges. Never keep all of that. And of course, ensure that you're having a time out of work. There's what we call work-life balance. Ensure that you have some time out from your work. And again, the treatment for mental health. Is it available? Yes. When you speak up, the early presentation makes it a better prognosis for you and I, and everyone could actually see a therapist. An early presentation to specialists will enhance a very good recovery. And I leave you with this inspiration snippet or wisdom. He said, Alex L., he said, I am thankful for my struggle, because without it, I wouldn't have stumbled across my strength. There is strength in you. There is a lot of activities in you. There is a lot of potential in you. Identify it and work with it. And again, said one other man, he said, Emma Watson, he said, I found that ultimately, if you truly love your heart into what you believe in, even if it makes you vulnerable, amazing things can and will happen. Amazing things can happen, and if you put your mind to it. And of course, finally, I will always say this in any of my presentation, in book of Philippians 4:13, he said, finally, brethren, whatsoever things that are true, whatsoever things that are honest, whatsoever things that are just, whatsoever things that are pure, whatsoever things that are lovely, whatsoever things that are of good report, if there be any virtue, And if you hear any praise, think of all these things. The moment you think about all of these things, then you have your mental health intact. So, and anyone can see. On this note, please, thank you for having me here. Thank you.